Um, it's a little bit early for me to speak about the project we're working on and not the subject of today's discussion, but I think since Mike spoke about it, I'll just share a little bit. When the floods hit in Pakistan, we were taken aback. There were 20 million people displaced and 1 million homes destroyed. This is back in 2010. And we had worked previously in the 2005 earthquake in Pakistan, and natural disasters, unfortunately for the world, are a reality. So my organization and the companies we're investors in aggregate to 23,000 people. And as an organization, we already own trucks and people that are specialists in logistics and supply chain and providing water and having water systems for factories. So we were able to mobilize that in partnership with the UN and our equivalent of FEMA to provide relief in many areas. So we were quite successful, and my goal is, and Mike and I were chatting about this, is to create a model where other companies can learn this. Because right here in the States, there are many companies that have these resources, but in a crisis like Katrina, are trying to provide some kind of aid, but don't have a model or a manual or have training that's done beforehand so they can mobilize immediately. And ultimately, in disasters, no government is capable of providing all the relief on its own, no matter how competent. So I think that's something we're working on, and that's sort of my goal for 2012. So the topic of another discussion. Before I begin, I just want to thank Wayne Silby. I don't know if he's here. Thank you. I listened to your talk with great interest, and in particular the company Lumni. About 12 years ago, I and my boss, I used to live in Hong Kong and work for a private equity firm. I wrote a paper for my firm to create a fund that would operate along the lines of a venture capital fund, but would do exactly what you're doing. We never implemented it, but it was a big company. but I think to do exactly that, to give loans to students and not take any principal or interest back from them and take a percentage of earnings for some period of time. And there were a variety of issues we dealt with, ethical issues like exploitation, because ultimately you own labor in a sense, and they're bound to give something back to you. And there's all these issues, but I think it's a fascinating model. I think I would like to applaud your taking the risk to implementing it and treating it as an experiment and trying it out, because not many people will be able to do this and have the courage to do so. So thank you, and I'm inspired. So with that, distinguished guests, ladies and gentlemen, it's an honor for me to be here and address this audience at the College of William & Mary. I also have the difficult task of addressing you just after lunch, so I'll try to do my best. One of my favorite phrases in life is moral imagination, and frequently we heard this term. To me, the definition of moral imagination is to be able to see the world exactly as it is, and then to have the imagination to see it how it should be, and then ultimately to execute that so that you can change the world. So I'd like to begin by sharing with you my story of moral imagination and the organization that I represent today, which is the Acumen Fund, which is an organization with tremendous moral imagination, a group of people that sees problems and then tries to find really innovative solutions to address those problems. I don't know how many of you are familiar with Acumen, but Acumen is a venture fund that operates globally in Africa and South Asia to address the problems of poverty through really three different areas. First, we invest capital in businesses that serve the underprivileged. And we do it in a little bit of a different way, which I'll come to in a moment. But aside from investing capital in areas of housing, energy, water, agriculture, and health, where we try to create businesses that provide goods and services at affordable prices to people in East and West Africa and South Asia, we also work very hard to create new models. We frequently face situations where people tell us that it can't be done, because the things we're trying to do very frequently are new things. They're not just microfinance as a social enterprise. They're actually new models, and I'll speak about some of them. And also, I think we work very hard to train leaders, because we believe that to tackle the problem of poverty, we need many people around the world that understand our approach, that can replicate that approach. So I'll speak a little bit about that as well. And then ultimately, as we solve problems of clean drinking water or malaria, we try to do it at scale, so it's not just for 100 or 1,000 people, but to reach millions of people. And we've been successful over the last 10 years in doing that. My own journey with Acumen began 8 years ago. At the time, through my business and my own foundation, we were engaged in philanthropy in two ways. One was to give money away as grants. The second was to create jobs, what we call net new jobs, in enterprises which we fund. So we believe that our contribution to philanthropy are through those two areas. And then we were increasingly frustrated because the more grants we gave away, the more dependency we created. And people kept coming back for more. And we come from a poor country, so the need is so much greater than the resources. So that was a point of frustration for us. The other point of frustration was we try to manage everything we do, including our charitable giving, in the same way we manage our business, which is sort of a professional investor approach. And as we looked at the business model of charity, it was clear and was troubling that charity had really not changed in hundreds of years. For centuries, people had been giving away money and not innovating, and that was a real issue for us. So at that time, I was introduced to the Acumen Fund 8 years ago, which was a unique group of people whose model was not that of what's common in social enterprise funds. At the time, Acumen was one of the pioneers of social enterprise, but their model was that we, as grant makers, or Acumen calls partners, who are effectively grant makers, would get nothing back. So we would make a grant to Acumen. Acumen would invest that capital, receive at least the principal back, that's their goal, and then reuse the money, but we would not receive anything back after making the grant. What that meant was, unlike most social enterprise funds, Acumen was not driven by, or did not need to return capital to investors. And there's a big role for those kinds of social enterprise funds, but for myself, we were prepared to make a grant anyway. And our own goal was not just to do good, our goal was to create innovation. And we felt that if Acumen does not have the pressure of giving anything back to us, although it should have the discipline to receive back money, debt and equity, from investments, but if it doesn't have the pressure to give money back to us, they will end up taking more risk and thereby innovating. And so we were hunting for innovation to change the business model of charity, and Acumen fulfilled that for us very, 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 very well. And in the last 10 years, Acumen has reached the lives of 86 million people. And I'll define that and break that down into its constituents, but 86 million is a meaningful impact to the problem of poverty. So Acumen invests in the areas of health, housing, water, energy, and agriculture through country offices based out of Pakistan, India, Kenya. Our Kenya office does work in Kenya, Tanzania, Uganda, and Rwanda, and also in Ghana, which does work in Nigeria and Ghana. And today we're looking at expanding our model into other countries as well. In the first 10 years, not only has Acumen demonstrated that patient capital is an effective tool in addition to aid and in addition to just market-based solutions, but also we were one of the early funds in the sector, one of the very early funds. And today there are 200 such funds around the world doing what we do, although the approach sometimes is a little bit different from ours. Not only have we invested $72 million of our own capital, but companies we've invested in have attracted more than $200 million in additional capital as co-investments or as follow-on investments from other investors. So our capital frequently is catalytic. Once we prove a model works, many, many people follow us and then grow those enterprises and help scale. Everything we learn, we try and share. So we have 10 years of knowledge, and we share this knowledge through case studies, to published research, and to reaching out to college communities around the world and sharing what we have learned. But most importantly, what we do is, aside from doing this work ourselves, we have a huge commitment to training leadership. And we have a global fellows program that takes in approximately 12 young leaders every single year, and we train them, having them spend 2 intense months in New York, and then send them to the field for a year to work at one of our investees. To date, we have trained 72 such leaders, and we've expanded this program last year to Kenya, where we train people in East Africa, so the costs are lower and it's more accessible. And this year we hope to extend this program to Pakistan, where we'll train people in Pakistan. And we hope that we'll have these regional and local fellows programs in addition to the fellows program out of New York, and we'll train a whole generation of entrepreneurs that understand our approach. I'd like to also share some examples of our work. In India, we decided that one of the best ways, and this is commonly known, to treat healthcare is to be preventive and have clean drinking water available to individuals. We were told that the underprivileged would not have the education level to understand that they should pay for a small amount for drinking water that's clean, and thereby avoid having huge healthcare costs or a lack of productivity when they're sick. We were also told that they wouldn't be able to afford it, and we were, all sorts of reasons were given why this would not work. Well, we went ahead and funded a company called Water Health International, and it's a spin-off from a US company. And today, Water Health provides clean drinking water and sells clean drinking water in 500 rural communities in India, providing on a daily basis clean water that's paid for to 500,000 people. Not only that, a number of co-investors came into that company after our own investment, and they have the company scaled tremendously. And today, in India and in many other countries, this model is being replicated. And even within India, there are many, many copycat companies, which we are proud of as the innovator. In Tanzania, you may have heard of a company called A to Z BedNets. President Bush, in his last year of his term, visited this company. It received a lot of coverage. A to Z was an entrepreneur who came to Acumen in 2003 in Tanzania to tackle the problem of malaria. We helped, as we say, with a small amount of capital and a large amount of business acumen. And we helped the company get a license from Sumitomo Chemical in Japan, since they made the best technology to weave insecticide into the fiber when it was being made, which made the bed net last a long time. The company's since built 2 factories. Our mistake was that we gave them debt, not equity. So we've been paid our loan back, but the company's gone on to be very successful. Last year, they made 29 million bed nets. They employ 7,000 women directly in those factories. I believe the year before they paid our loan back, which was 3 years ago, if I'm not mistaken, they had $36 million in sales, and they turned a profit. The company says that they are responsible for 15% of global anti-malarial bed net output today. So that's another successful example. And in Pakistan, one of my favorite companies is a company called Jasser Farms. This is a company that, I don't know how much people are aware of Pakistan. Unfortunately, the country gets a lot of bad press, much of it true, but there's a lot of good news, like the 6th most populous nation in the world should have. And one of the pieces of good news is we are one of the world's large producers of rice, wheat, cotton, corn, and milk. And we're top 10 in all these crops worldwide, despite having the lowest agricultural yield in all these crops. We have the lowest wheat yield per acre in the world, and rice yield. Yet we're so fertile that we're able to be a major producer. We feed the 6th most populous nation in the world, and we export. So we're sort of a mini Brazil in our part of the world. And in milk, it's the same situation. We have the lowest animal yield of milk, yet we have almost 50 million head of cattle, so we produce a lot of milk. Now, farm incomes are massively dependent on milk in Pakistan, and Jasser Farms is an Acumen investee that has taken American bulls and Pakistani cows and successfully crossbred them. It's a great joint venture. When we import doses of semen from around the world, unfortunately the offspring is not attuned to our environment. They're susceptible to disease and getting sick. So the best way to do this is to crossbreed naturally, which they've successfully done. So the company, aside from having its own farm, currently has the 4 most valuable bulls in the country, which from this year will start selling 125,000 doses of semen at 1/10 the price of imported semen, and creating a whole new generation of cows, which will transform farm economics in Pakistan, and we can replicate this success in other countries. Acumen has been very successful in replicating success. We've taken drip irrigation from India into Pakistan. We've taken solar lighting concepts from India to East Africa. So as we do that, this will be another model which we hope we will replicate in many countries that have very low yield per animal in terms of milk production. Acumen doesn't say that aid does not have a place and market-based solutions do not have a place. In fact, we feel that aid is vital in short-term solutions, but aid does not solve the problems of long-term poverty alleviation. In the same way, market solutions are relevant when charitable dollars run out, when the $8 run out, but there's a big space in the middle to build businesses that serve the poor that ultimately one day when they have scale can be entirely market-based businesses, and that's the space we operate in. In terms of data, 7 million people have been provided electricity through our investees for the first time in their lives so far in 10 years. 1 million farmers have improved their farm productivity through Acumen investees, and each year 50,000 women receive maternal care, including 13,000 births through hospitals that we funded on a socially enterprise and sustainable basis. Currently, Acumen it operates in 8 countries. We've invested, as I said, $72 million in 65 companies, and other investors have provided $200 million to complement that investment. We've trained 72 global or regional fellows that will go on, and many of them have already gone on to build companies that are social enterprise companies and are very successful. And we've impacted the lives of 86 million people. We've been operating for 10 years, and if we fast forward 3 years, by 2015, our goals are to double much of this impact. We're going to take 10 years of learning and accelerate that, both by investing more actively and also by replicating this in more geographies. So by 2015, we hope to be in 15 countries, not 8. We hope to have doubled the invested capital from $72 million to $150 million. We would have grown our alumni group for our fellows program between our global fellows, regional fellows, and local fellows to 400 people that would have been graduates. So our goal, therefore, is to have 400 trained entrepreneurs out there who know our approach to philanthropy. And they will be able to replicate the models that we've already innovated, made mistakes. And by the way, I mentioned successes. We've obviously had failures as well, but few. And on a portfolio basis, Acumen has returned 1.01 times the capital invested. So we've received back the money we've invested, which is really our goal. But on a portfolio, we've been quite successful. So they've seen the failures and the successes, and they can replicate this. So we will have 400 entrepreneurs out there doing this work. And ultimately, in terms of impact, we want to go from 86 million people to 150 million people by 2015. Before I end, I'd like to share one personal point, which I'm frequently asked what it means for Acumen, what it means to me when I'm asked, is Acumen successful? And I measure that in a couple of different ways. I mean, first of all, of course, Acumen must innovate. And our model is designed to not return capital to grant makers. So we must continue to create new business models, like selling water in places where people are not used to paying for it, and teaching people that it saves large volumes in healthcare costs. But also, I think it's very important for us to train leaders through our Global Fellows program. And I think as far as to the extent that our university students here, I think you should consider looking at our programs. They're quite competitive, but they do train a whole new set of skills that you might want to take a year away and learn about. So those are our 2 goals, to innovate and also to train other people to replicate our approach. And if we go back to my point about moral imagination earlier on, I think I'd like everyone to use their imagination to define the poor not as the poor or the underprivileged, to just simply define them, to imagine defining them as customers. And I think if we fight poverty by making the poor being defined as low-income customers, then not only can we change business, but we can also change the way philanthropy is done. So thank you.